I'm Daniel Lin. I'm a medical oncologist over at Thomas Jefferson University Hospital. I covered a number of key abstracts of non-colorectal GI cancers from this year's ASCO, starting with the Dante trial for gastroesophageal cancer. That was a perioperative trial of FLOT with atezolizumab versus FLOT alone for resectable esophageal gastric cancers. It showed that there was improved path regression and response rates in this population of patients, but further analysis on survival is still pending. I also discussed the notable study for pancreatic adenocarcinoma patients. So the study looked at gemcitabine plus nimatuzumab, an anti-EGFR monoclonal antibody, compared with gemcitabine alone for locally advanced metastatic pancreas cancer patients who are KRAS wild type. And it did note that there was an improvement in both progression-free and overall survival in this population of KRAS wild type patients. I also looked at the ECOG ASCO22 study comparing capecitabine temozolomide with temozolomide alone for patients with G1, G2 pancreatic neuroendocrine tumors. And in that study, there was a significant improvement in progression-free survival. So this is a very reasonable option for patients with high tumor burden with very symptomatic disease. And finally, we looked at the two biliary cancer abstracts. One was for the HERB trial, so that was trastuzumab deruxtecan in HER2 overexpressing biliary cancers. And this study did demonstrate high response rates in the HER2 positive patients and also good disease control rates, though not as high response rates for the HER2 low expressing patients. So this may be a new option for HER2 positive disease in biliary cancers. And finally, the Phoenix CCA2 trial, these were updated results of efficacy. So this is with futibatinib, which is another FGFR inhibitor. And it also demonstrated strong, durable response outcomes in patients who have FGFR2 fusions or rearrangements.